The World Health Organization gave us this model or they depend on this model of a Vedas Donabedian who created kind of the overarching structure for healthcare quality improvement around the world. And they base their patient safety models and all of what they do in healthcare quality improvement on the Donabedian model. And what the Donabedian model tells us is that there needs to be a structure through which care is provided. And we need to be able to monitor patient-centered outcomes. In other words, we need to be able to look at the outcomes of the patient. And you know, when I see many of the medical teams that come back and I look at what they're studying and what they're assessing, it's more about what was the experience that we had, what was the number of patients that we saw. It's not looking really strategically at the patient outcomes. So how do you achieve this? It means that we have to do, if you're really serious about achieving some level of patient safety, we have to do it in the construct of a place that's normally used to providing healthcare, right? When we look back at Maria's story, we see some real challenges. But I think the big ones that we can pick out is that there were non-medical church volunteers that were being used to fill prescriptions. Sometimes that happens that non-licensed people end up back there filling prescriptions. Those medicines are then given in Ziploc baggies. We would never do that here, would we? Would have, you know, I don't know, I haven't been to a pharmacy here lately and have them hand me a Ziploc baggie full of pills. Typically, the drug dealer on the corner gives out medicines in Ziploc baggies, but that's usually not what happens at the pharmacy. And those caregivers then take those baggies of medicine home to a place usually where there's not really good storage capability away from kids, right? A couple of big harmful assumptions that we deal with in looking at this idea of patient safety in medical missions. It's that anything a medical team can offer is better than nothing, right? So it's kind of the anything is better than nothing perspective, or something is better than nothing. And I'm not sure that's the case when the something has the potential for harm. So we need to think really careful about that, and if that's a belief that we hold, we really need to think about that. The second is because we have limited time, we should emphasize on the number of patients and not necessarily the quality. And I think that's another one that really inhibits our ability to provide good care.